Good day, everyone. I am Sigrid, an infection control officer. I am tasked to discuss about the basic infection control module for the Safety Skills Essential program. Infection prevention and control module is part of the SSE because these are basic knowledge that everybody should know, especially now that we are facing a pandemic. This is the outline of my lecture. I'll be discussing the following topics: healthcare-associated infections, standard precautions, transmission-based precautions, accidental exposure, cleaning of the hospital environment, disinfection and sterilization, multi-drug-resistant organisms, patient placement and transportation, emerging and re-emerging infectious diseases, focusing on COVID-19, reportable communicable diseases, and waste segregation. The antimicrobial stewardship program will be discussed by our AMS officer. But before we proceed to our main topic, let me share to you an actual healthcare-associated infection in Makati Med in 2013. This case will show us the importance of observing proper infection control measures. HCN is a 78-year-old male. He was diabetic, hypertensive with coronary artery disease, arrhythmia, and post-stroke. He was only admitted for dizziness. Patients with this kind of condition are usually discharged after 2 weeks. Let's find out what happened to the patient. On his 12th hospital day, the patient complained of right-hand pain in his peripheral IV site. On the following day, he had chills and high fever. If a patient presents with chills and high fever, the doctor usually suspects infection. Thus, an antibiotic was ordered for the patient. On the 14th hospital day, the patient experienced multi-organ failure. Another antibiotic was ordered and given to the patient. A blood culture was also ordered to check the cause of infection. On the 17th hospital day, the patient had a blood transfusion, and again, for the third time, his antibiotics were changed. On the 18th hospital day, the result of blood culture came out, and it turned out positive for MRSA, or methicillin-resistant Staphylococcus aureus. MRSA is a multi-drug resistant organism. It means it is resistant to common antibiotics, which explains the ineffectivity of the first line of antibiotics given by the doctor. On the 20th hospital day, sadly the patient expired, and his cause of death is multi-organ failure, secondary to septic shock, secondary to MRSA bacteremia due to peripheral IV phlebitis or inflammation of the veins where the IV was inserted. We could have prevented the development of phlebitis and eventually the death of the patient if all healthcare workers follow strict infection prevention and control measures, such as hand hygiene before touching the patient's IV site, observance of aseptic technique, disinfection of the IV insertion site before inserting the IV, and use of gloves during insertion. Please also don't forget that if a patient complained of pain in the IV site, one should always assess and check for signs of infection. If there are signs of infection, IV access should be removed immediately. This slide shows the economic impact of healthcare-associated infection per patients. Patients who had infections are given costly antibiotics, and patient stays longer in the hospital. For this patient, he had an additional 294,000 in his bill on top of his original hospital bill due to infection. However, on top of the money incurred due to high, the life that can be lost is priceless. Our goal here is to prevent healthcare-associated infection, and we can prevent healthcare-associated infection by practicing infection prevention and control measures. So what is infection prevention and control? According to Oxford Dictionary, infection is a disease caused by an organism. In our case, the organism that cause infection is the MRSA. Prevention is to keep something from happening. How do we prevent phlebitis? We can prevent it by practicing strict infection control measures such as hand hygiene, aseptic technique, and proper skin disinfection. When we say control, it means to regulate, limit the level or intensity, maintain influence or authority level. In this case, the infection is already present, and our main goal is to prevent the spread of infection. Patients and healthcare workers can acquire infection in the hospital. Patients can acquire infection during the course of receiving treatment for other conditions. For example, a patient came in for cesarean section. The average length of stay for a patient who had cesarean section is 3 to 5 days. However, due to infection in her surgical site, she has to stay longer in the hospital for the treatment. As healthcare workers or staff working in the hospital can also acquire infections due to exposure to blood, body fluids, secretions, and excretions that may contain transmissible infectious agents. Examples of common diseases that we can acquire are tuberculosis, blood-borne diseases such as HIV, Hep B, flu, and we can also acquire COVID-19. Thus, we have to strictly follow infection prevention and control measures to prevent all of this. The Infection Prevention and Control Department monitors the following healthcare-associated infections as part of the clinical and managerial indicator of the hospital. We monitor ventilator-associated pneumonia or VAP, catheter-associated urinary tract infection or COTI, centrally associated bloodstream infection or CLUBC, and surgical site infection or SSI. Consequences of HAI. As I mentioned earlier, HAI can add cost to patients and families. It can cause more serious illness, prolong hospital stays, induce long-term disabilities, or even death. But the good news is, at least 50% of HAI could be prevented as long as we practice the proper infection control measures. This slide shows the healthcare-associated infections of Makati Medical Center from 2018 to 2019. For 2018 and 2019, we have no reported case of BAC. The most common HAI in Makati Medical Center is CLUBC. For 2018, we reported 40 cases of CLUBC and decreased to 18 in 2019 due to several infection control measures implemented. But still, our goal for CLUBC is 0. COTI cases increased from 4 reported cases in 2018 to 9 cases in 2019. Still, our goal for COTI is 0. In total, we have 27 HAI cases reported for 2019. Infection control also monitors surgical site infections for the following procedures. For OB, we monitor abdominal hysterectomy and cesarean section. For ortho, we monitor hip and knee arthroplasty. For surgery, we monitor appendectomy and open cholecystectomy. For TCBS, we monitor CABG, and for opta, we monitor cataract surgery. For 2019, we have 1 reported case of SSI for abdominal hysterectomy, 2 SSI cases for open cholecystectomy, 11 SSI cases for appendectomy, and 12 SSI cases for cesarean section. This is the chain of infection. For infection control, our main goal is to break the chain of infection. So how do we break the chain of infection? We can break the chain of infection by practicing infection prevention and control measures.